Just live how your grandparents were living, because our bodies are designed to live in such a natural way.
Language and simplest terms, what to eat and how to eat correctly. It's whole foods.
Yes, true. There are still some men who have that high testosterone levels, and they are mostly in prisons.
I believe that even eating outside, you can still make right choices.
So what you are doing is actually what you should do for a healthy lifestyle.
Fatless Life.
Welcome to the Fatless Life podcast. Here we talk about the truth in the world of fat loss, health, and well-being. To answer all the questions, today I'm with Dr. Zeynep, who will help me with that.
Hi, Filip.
How are you today?
Good, how are you?
Good.
Thank you for having me.
Thank you for coming. There are two very popular medications nowadays, labeled as fat loss medications, Ozempic and Mounjaro. And there is many people who are either taking them or considering that option. And in Fatless Life, we worked with many clients so far, and we help them to kind of minimize side effects and navigate through the course of medication better and easier. However, there is a lot of people who suffer from severe side effects, but the biggest problem that we found so far is they're not really able to stop medication, because while taking the medication, due to lowered appetite, obviously, they undereat nutrients, they undereat calories severely, which slows down metabolism significantly. And then obviously, as soon as they stop taking the medication, the weight starts coming back. As soon as they start seeing the weight rebound, they get scared, obviously, and they start taking the medication again. So I know some examples of people who are on these medications for more than 2, 3, 4 years. Now, we have our method dealing with that, obviously, to prevent metabolism of slowing down, but in spite of low appetite, we structure food in a certain way that helps people to actually even speed up metabolism along the way and process of weight loss. And then obviously it helps them to eventually quit the medication, because that is the goal in the end of the day. What is your point of view from your professional side, both when it comes to side effects, but also how to really navigate and structure everything while on the course of medication in order to not harm your health, but also in order to quit medication eventually?
Yes, so actually it is always better to go with the routine way. It's always the diet, the exercise. So even they are taking these medications, they have to exercise actually, and they have to eat enough food. And to avoid the side effects, it's better to start to increase the dose gradually. That's why they need a doctor appointment. They need doctor visits to arrange these, to prevent these side effects, and also to follow their health. But many people, because they are the medicines like over the counter, you can directly go to a pharmacy and buy for them.
So you can buy even without prescription?
Yes, true. And that's why there are many people who are taking without seeing any doctor. But there are also some contraindications. For example, if there is any thyroid medullary cancer in your family, definitely you shouldn't use them, both of them, because they can trigger thyroid medullary cancer. And also, if you are planning to get pregnant, definitely 2 months before getting pregnant, you should stop these medications. And during pregnancy and lactating, there is not enough data, safety data. So they shouldn't be used during pregnancy or in the postpartum period, especially they are lactating, breastfeeding. And also pancreatitis is another problem. If you have any pancreas issues before, definitely you shouldn't use these medicines. So it's always better to see a doctor. And then weight loss program is a multidisciplinary program actually. There are even GPs and internal medicine specialists, endocrinologists, psychologists, psychiatrists, dietitians, personal trainers, everything including. And weight loss is a process, but many people are in a hurry.
Yeah, that's the
But
problem.
yeah, during weight loss, actually, what you are doing is actually what you should do for a healthy lifestyle.
Correct. That's why
Eating.
I always say there is a huge difference between weight loss and fat loss.
True.
And the problem with most of people is they just want rapid weight loss, which means that you're not necessarily only burning fat or losing fat, but also quite a lot of muscles with that, which has so many health implications afterwards. And the problem
True.
with the medication that we mentioned is one of the main problems is that I'm just thinking from cell regeneration perspective and from organ function perspective. How will body be healthy or stay healthy in the scenario of deprivation of nutrients? Like if your appetite is so low and even the food that you eat has no nutrients or very little nutrients, how will that affect body on the cellular level as well as organ function? Like obviously I don't have medical degree, but thinking logically and from what I know and from all the experience that I have,
Yes.
if you don't provide enough quality nutrients, specifically proteins, essential fats to your body, and alongside with that you add a lot of processed sugar and what we call junk food and nutrients that are not really good for us, what will happen when it comes to inflammation, overall inflammation, as well as long-term function of the body? So it is no wonder that at some point in the future there will be some failure, there will be some disease.
True. Thank you for this question. So let's talk about macronutrients and micronutrients.
Correct.
Macro ones are fats, carbohydrates, and protein, and micronutrients are vitamins, minerals, etc. So what we are eating, they always include usually fats, carbohydrates, and protein, but also they should include some vitamins, minerals, trace minerals, because our body, yes, it needs energy, but also every cell works with enzymes, and these enzymes require some vitamins or minerals. Like, for example, for your muscles, we need definitely calcium and magnesium. And if you're eating, like, let's say potato fries, yeah, I know it's delicious. It can give you the energy that you want, but there's very less amount of micronutrients.
You're talking about fried
Yes,
fries.
fried
But like
fries.
even, let's say, sorry to interrupt, I mean, let's say you will get some complex carbs from potato that's in there. But that will come in such a combination of terrible quality fats, trans fats.
True.
So like the proportion of the value that you get from those carbs and the damage you get from everything else
Yes,
is
it will
kind
cause
of...
inflammation, and inflammation will reduce the weight loss also. That's why while taking these medicines, Mounjaro and Ozempic, people should avoid eating junk food actually. They should eat real food.
Correct. Whole foods.
Yes, whole foods, whole grains, whole rice, salads.
That is, like, if I have to give advice to someone in a simplest language and simplest terms, what to eat and how to eat correctly, it's whole foods.
Yes, true.
And we mentioned inflammation, and obviously any disease comes from the inflammation.
True.
Somewhere in the body. And from our experience, majority of inflammation cases come from some sort of lifestyle factors. Food, stress are the big factors, obviously alcohol, smoking, and we all know that. But also some autoimmune diseases, from our experience, can be reversed as well as improved significantly with adjusting lifestyle factors that we previously mentioned, adjusting the food, removing some ingredients and foods that increase inflammation. And I'm not talking only about the sugar. Obviously, sugar is the worst when it comes to inflammation. And that's one of the reasons why, for example, cancer patients, the first thing they should do is remove the sugar from their diet. But also there are some foods that are not considered unhealthy, that are also not good for inflammation, that also could elevate inflammation in the body. What would you recommend if we are talking about prevention of diseases? And obviously everyone wants to be healthy. So if we agree that the cause of every single disease is inflammation, correct?
Yes.
So if we agree on that, then how can we most effectively make sure that we have our inflammation under control? And one more question. Is there a correlation between inflammation and acidity or pH value of the blood?
So actually pH value is always between 7.35 and 7.45. So
Correct. But like, let's say if someone's body is more acidic.
yes, it will be balanced by the kidneys. Yeah, it will be balanced, but of course it will cause some increased load, like antioxidant. Then we will need more antioxidants, for example, to ease it. And you can also take some basic food or drinks. You can add these things to your diet.
Like I always recommend some antioxidant foods such as green veggies or berries, blueberries especially.
Avocado.
They're very good and stuff like that. But like talking about the inflammation as I would say the most critical part of longevity and health, like being in control and not having any inflammation in the body. What would you recommend as the most important measures and steps in reducing and lowering inflammation?
Actually, the answer is easy. Just live how your grandparents were living, because our bodies are designed to live in such a natural way. They were walking, they were going to their farms, they were walking with their animals, they were eating from their farms again. But we cannot do this in still life. So, and there was no electricity. At night they were getting bored and they were sleeping earlier and they were getting up with the sunrise. So if you can do, definitely you should go to bed after 10 p.m. And you can wake up, you should sleep at least 6 hours for adults and for teenagers minimum 7 hours, which is free actually.
Yeah.
And of course eating healthy raw foods can help. Organic food, yes, but let's be honest, we are working, we are usually out of home, and sometimes there is no time to cook at home. So
of course.
what will you eat in the outside?
But like even I eat outside a lot. And living in Dubai, luckily, there is plenty of healthy options outside.
Yes.
So I believe that even eating outside, you can still make right choices. Or let's put it like this. If your aim is that in any given situation, you make the best possible choice.
Yes.
So if your situation is, let's say you're on board, you're flying a 10 hours flight, and what are you going to do? You have no option unless you brought food, but let's say you didn't. So your option is to eat the food that's been served, right? Which is not the best. But in that moment, that is the best, right?
Yes.
So if you just apply that principle that in any given scenario and situation, you just choose what is the best for you in that moment.
But sometimes we think, for example, salads. We all know that salads are healthy. But
Right.
if there is dressing, then definitely the calories will be so high. So even if you are choosing a salad, it's better to choose a salad without any dressing.
Yes. I always recommend a limited number of ingredients in the meal. Like if the dish has 15 ingredients, it's probably, even if all the 15 ingredients are healthy, it's probably not the best for our digestive system because every ingredient has different time of absorption and it's just very confusing for our body to digest 15 ingredients in the same time.
Yeah.
Like I believe that it's better way, obviously, to control calories, but as well as for overall health, to have less ingredients in the dish in the meal.
Actually, it's also sensible because previously our ancestors couldn't reach the food so easily. It was very hard.
Correct.
And they never had 15 different nutrients
Yeah.
in a meal, actually. Yes, of course, it's better to keep everything simple.
Like there are some dishes that I've tried recently, where there are actually only few carb sources in the dish.
Okay.
Plus. So obviously, there's one more interesting thing that we never really listen how our body reacts and responds on the food. Like if we have a meal and we feel sleepy after half an hour, that's a sign.
Sometimes.
Our body is giving us sign that something is wrong.
Yes,
Maybe it's
true.
gluten, maybe something else. There is something in that meal that doesn't sit well with us.
Yeah, actually, there's one hormone, cholestokin. When you eat, that hormone increases, and that hormone actually helps for the fat digestion. But also at the same time, it goes to brain and causes sleep. So if you eat too much fat in a meal, it will definitely increase this hormone, and you will feel more sleepy.
Does that depend which type of fats? Like, is it
No, any type of fat.
Any
And
type of
also,
fats.
there's another one option or possibility. Of course, high blood sugar.
yeah?
Even if you don't have any diabetes or prediabetes, 80% of normal adults having high blood sugar levels. And it can also cause sleep feeling or thirsty feeling after food. So we should also prevent this.
You mean 80% have high blood sugar after food?
Yes, after a meal.
After a meal.
Yes, actually, this is the beginning of diabetes.
But
And
is it
after-
only if the meal contains carbs?
No, any food actually. Not. For example, we know protein and fats. These products need more process for digestion because
need
they should
longer
be
time to digest,
digested
correct.
and then they should convert to
Yes.
glucose. So after 2 hours, they can cause high blood sugar levels.
But
They're
isn't-
definitely carbs. Yes.
But is less insulin response when you eat, let's say, a meal that doesn't contain carbs? Like, let's say,
like what?
so what we recommend, let's say, if the meal contains proteins and healthy fats, let's give example. Let's say chicken and some avocado and some veggies. Okay? So the digestion of this meal will be prolonged due to fat content.
Yes.
Because fat prolongs.
But veggies include carbs. For example, carrot.
Yeah, but let's say some green veggies that don't contain
That much
that-
carb.
that
Yes,
much carbs.
sensible.
Let's
okay.
say
Yes, then
some
you won't
broccoli,
have.
spinach, and
Yes, definitely.
asparagus.
Then you
okay?
won't have.
So the insulin response. That's why when we work with someone with diabetes, we recommend these kind of foods because insulin response will not be an insulin demand to process that glucose will not be as high as
True.
if you eat rice and not to mention some simpler carbs or sugar. So in that way, we make sure that there is no extra overload on pancreas.
Yes, true, of course. This is a good example to prevent high blood sugar, definitely. Because every adult is a candidate to have high blood sugar level. That's why we have to be cautious in every meal. This is what I was trying to say. But your example is if you eat green veggies and then protein, of course you won't have that high blood sugar level.
I found that people find this shocking, what you just mentioned, and whenever I say that to someone, they're shocked that you can actually end up having diabetes without eating sugar. Like even if you eat, let's say you eat oats and rice every day for every meal, there is still big load on pancreas, right?
True.
There is still big insulin demand.
They are carbs.
Even though we can consider rice or even potatoes, doesn't have to be rice. We can consider potatoes and oats healthy, right? Or let's throw in even some fruits. But if you are not careful and if you overeat those frequently enough in a long enough period of time, even though they're healthy, so you're not doing anything unhealthy per se.
No, but they also include carbs.
That's what I'm saying. So carbs, it doesn't necessarily have to come from the
Sugar or
unhealthy
sweets.
source.
Yes,
People think
true.
you can only get diabetes if you eat sugar, which is not the truth. You can get diabetes by eating healthy foods.
Yes,
You can
true.
get diabetes from grapes.
It's all about the portion. That's
If you
true.
eat every day half kilo of grapes, I mean, it is no difference than eating 300 grams of chocolate every day.
True.
in terms of our load on pancreas, insulin demand, and the effect that that would have on our sugar and insulin system. And I have one question regarding insulin resistance. There is many people who have insulin resistance who are not even aware of it,
True.
which simply means that their receptors are not sensitive enough to accept that insulin and all the nutrients and the glucose from the bloodstream. We obviously, in these cases, adjust the diet, of course. In some instances, we use metformin, glucophage. What is your opinion about glucophage, doses? We usually find that, unless the case is severe, we don't go over 500 milligrams of glucophage, and we usually do it lunch or dinner time. Ideally, we eliminate carbs, so we help the system even more from that perspective. But what is your opinion about glucophage? And there is many studies nowadays that glucophage, microdosing glucophage, is very beneficial for longevity and health overall, whereas it used to be considered as kind of like not that healthy medication, let's put it like that. But nowadays, a lot of people, even who don't have insulin resistance, are using glucophage.
Yes, sometimes they're using it to weight loss, to lose some weight, but of course, weight loss is not a benefit from metformin anymore because we have other options. And metformin is a safe medicine. We have been using it for maybe more than 50 years now. We know it very well, and it really helps for insulin resistance. And not just 500 milligram, you can use 1000 or 2000 milligram.
So, yes, so when it comes to that, we found that if we go for 1000 milligram, in most instances, clients will have some side
Bloating.
effects,
Yes.
nausea and stuff like that.
Actually,
But if we go for 500, there are no side effects.
yeah, I see your point. So metformin is also a medicine that we should increase the dose gradually. In the beginning, 500 milligram at night for 1 week. And the second week, you can use it 500 milligram in the morning and at night.
Morning and night.
Yes.
Okay.
On the third week, 500 milligram in the morning, 1000 milligram in the evening. And starting from fourth week, 1000 in the morning and 1000 in the evening.
Okay.
So if you
And
gradually increase the dose,
But then what do you do then when you reach 2000 milligrams?
so then we are using it for 2000 milligrams.
For how long? It depends.
If there's diabetes, lifelong, as long as there is no another reason to change the medicine.
Okay, but like if someone doesn't have severe insulin resistance,
Yes, okay. Then
like
you
we
can...
usually, what we do, we say, okay, let's set a goal that in 6 months,
Yes.
we'll go through phases of obviously diet changes and glucophage, but in 6 months we will stop glucophage because the cells can resynthesize.
Yes, that's true. It's reversible.
It's reversible, right?
True. And actually the reason is the fatty tissue inside the muscle cells. So if these patients can lose fat loss, like fat loss is number one treatment actually for insulin resistance, then it can be treated. Fat loss, yeah. Inside the muscle cells, there's fatty tissue, increased fatty mass, and that's the reason of insulin resistance. So people should not just weight loss, people should lose fat mass.
But it's like, I guess it's kind of like you have to put both together because if you have insulin resistance, it's difficult to lose fat. So it's kind of like you have to
There's no circle. Believe me,
Yeah,
they can lose weight. No, they can lose weight. It's all about if they really want it subconsciously, the success rate will be increased, definitely. People should internalize that they need these lifestyle changes for lifelong, for a healthy, good life.
Do you have that problem with your patients when it comes to discipline and when it comes to, I can call it weakness to the lifestyle dopamines they're addicted to when it comes to, let's talk about food, it can be anything else. Like they see it, I'm giving away my entire life by cutting few types of food that I like. Like many people don't have awareness, okay, I'm doing this not just for a short-term result, whatever it is it dealing with insulin resistance or losing fat or whatever. So I have to, as you said, correct the habits to live long and happy life, ideally, right?
True.
Because in the end of the day, it's not only about how long you live, it's like, what is the quality of life? If I'm gonna spend all my life in hospital, then I don't want to live long life. I want to live very short life, right? So I want only to live long life if my life quality is good,
Yes.
which is in the first place comes from my health. How can quality of life be good if you're unhealthy? That is like the first step, right? But people see that in a way that I'm now giving up, or if you recommend, or if I recommend something, they'll say, okay, now it's kind of mindset like they're doing us a favor. Like, I will do this, I will give away and give up my ice cream, but I better have results. Because if I don't have results, why did I give up my ice cream? It's very short-sighted way of thinking.
True.
And I don't understand, do they really don't understand the health implications they will have in the future? Or is it just ignorance that they don't care? Because if they start thinking about it, they'll get anxious, because everyone with the brain in their head will understand what will happen in 5 years from now if you keep doing what you're doing. Like, it's not a rocket science that if you eat in a certain way and if you live unhealthy life in a certain way, if you have that 5 to 10 years down the road, you'll end up in a bad situation health-wise. It is not a rocket science. Like, everyone understands that.
Yes. Everyone knows how to live a healthy life. Everyone knows
Right?
healthy lifestyle, actually.
Like, everyone knows that sugar is unhealthy. Like, you don't have to be expert to understand that. Now,
True.
the interesting thing is that people don't care about their own life and their own health.
But we have short-term benefits and long-term benefits. Many people are focused on short-term benefits, pleasure, because it gives us pleasure. But in the long term, no, it
So what would be
causes-
your recommendation? How to overcome that problem? Because I find that that is single biggest problem that we have. How to prioritize long-term vision and deal with short-term dopamine cravings from, in this instance, food.
Yeah, if there are cravings, definitely I'm asking my patients, please observe yourself, how you feel. Maybe it's because of some emotions, or maybe it's impulsive behavior. First, they should focus on this. And also, it can be a problem of candida. If there is overgrowth of candida in your gut, definitely you will crave for foods, sweets especially. Yeah,
So candida can cause sugar craving.
Yes.
What are the other things that cause sugar craving? I mean, I believe that probably, correct me if I'm wrong, in most cases, dopamine is number one.
Yes.
So whether we are sad, if we take that ice cream, we'll feel better in that moment, and then we'll feel worse again, and then in order to feel better again, we'll eat it again. So I think that's number one problem is dopamine from food.
Yes.
But you mentioned candida. What are the other? Are there any other?
Sometimes you crave for food. You feel like you're hungry, but actually, your brain gives you the sign of thirsty feeling, but you misinterpret it, and then you feel like you are hungry. That's why every time you feel hungry, just drink some water. And
Okay.
despite of this, if you're still having that hunger feeling, then you can eat something.
Then drink another glass of water.
Yeah.
So thirst can be confused for hunger.
Yes,
Okay.
definitely. And also low blood sugar can cause this.
Okay, so is it like I hear many times like people say, "Oh, my sugar dropped, and I
Yeah.
feel like having some sweets."
Yes, reactive hypoglycemia.
Why that happens?
Definitely because of high glycemic index food. So we have glycemic
So if they earlier
index.
had high glycemic,
Not
which is
just-
simple sugar,
Not just the earlier meal. It's like for a long time. If you have been eating high glycemic index foods for a long time, then after a meal, like around between 2 to 4 hours later, you will have a drop in your blood sugar levels, and that can cause sugar cravings.
so basically, when people say my sugar dropped and I need something sweet, that is caused by eating sugar in the first place.
Yes, that's true.
So if you stop eating sugar in the first place, which is high glycemic foods, you will not have drop in sugar, which will cause you to crave
Yes,
sugar.
it's
So
also
it's a
reversible.
loop. It's a
It's a
vicious
loop,
cycle.
and also it's reversible. Just with diet, just with eating healthy diets, they can reduce this. They can come over this.
Now there is a lot of there are a few supplements that I always recommend, such as fiber supplements such as psyllium husk, a certain multivitamin mineral complex, omega-3s and stuff like that, just for overall health. Because I believe that with today's way of eating, even if you manage to get to the best quality sources of food, it's still not as easy as it used to be 100 years ago to get all micronutrients that you previously mentioned in your meal. That's why I believe that the importance of supplements today is much greater than it used to be 50 or 100 years ago. Can you tell us what is the difference between supplements and medications?
Yes, sure. First, we need supplements actually because now many foods are genetically modified and they really don't include enough micronutrients as they had before. And definitely we need to take some elements and vitamins from outside sources. And so medication means that there is a safety, at least one safety study, and efficacy was checked, and FDA or other drug departments approved that medicine, and it's coming from a pharmaceutical company. It is strictly controlled, checked, and then you can have them from the pharmacies. But a supplement, so by the way, you cannot make any advertisement for any medication. If it's from a pharmaceutical company, you cannot make any advertisements. But supplements are not like this, and they are not approved by any drug department or FDA.
Supplements are not approved by FDA?
Yes, and also they are not strictly checked or controlled unless the company wants it. If the company wants and then they are sending the samples to some organizations, then they put their certification stamps on these supplements and they are safe. You can use them. But still they don't have much efficacy studies or safety studies.
And
so it's always better to get some, for example, vitamin D. Many people are using vitamin D. And there are some supplements and medications. Okay, so for example, Euro-D. It's a medication. You cannot see any advertisement for it. You can get it directly from the pharmacy. But Solgar is also, we can trust Solgar. That's why I'm giving its name. It's a very old brand and it's a supplement. So even if you are choosing a supplement, you should use a company that you can trust.
Trustworthy, yeah.
And you can check the certificates on them. For example, for omega-3, there are many omega-3 supplements. But the good omega-3 is coming from seafood. So if it's from flaxseed, I don't prefer to use plant-based omega-3. I prefer to use seafood-based omega-3.
So
But seafood includes heavy metals. That's why while taking that omega-3, you have to check the certificates that it's not including any heavy metals. And the same problem is also valid for protein powders. Many protein powders include heavy metals, and there is one project for it, Clean Label project. People can check for it. If the protein powder that they are using have that Clean Label project approval, then it's good.
Clean Label project approval.
Clean Label project.
What does that mean?
So according to this, there are safe protein powders and not safe ones. So they should go and check the project and the brand name of their protein powder.
Okay. Clean
Label project.
Clean Label project.
Yeah.
Okay. There is quite few symptoms that we find people struggle with, such as bloating. Bloating is a big one. Mood swings. We mentioned sugar cravings. Bad or poor sleep quality. These are very common symptoms that we find among people. And what we also find is that obviously there are certain hormonal imbalances that could impact these symptoms, as well as some gut issues, food intolerances, and stuff like that. We usually primarily work with females who are above the age of 30 and who have some metabolic changes in their body. females who are perimenopausal or even menopausal, and there are certain hormonal changes. What would your advice be first for someone when it comes to having regular checkup on their hormone levels, which I find that not many females do, as well as would you recommend some sort of HRT?
I definitely can recommend HRT.
Even guys, let's say 45-year-old male or 45-year-old or 50 female who have his or hers testosterone or estrogen imbalanced, would you recommend hormonal replacement therapy?
So it depends on their symptoms. About testosterone, actually, today every man have testosterone deficiency.
Interesting.
Yes, according to 1980s, the testosterone levels definitely decreased. Previously, like 100 years ago, and it was between 800 and 1200. Now it's like between, if it's above 200 or 250, according to laboratories, it changes. Then we say, okay, it's enough. But actually, it is not enough. But there are still some men who have that high testosterone levels, and they are mostly in prisons.
Okay.
So yes, do you really want to have that much high testosterone levels?
Okay, but let's say, so you're saying that normal level of testosterone today and normal level of testosterone 100 years ago is different number?
Yes, different
What's
numbers.
considered normal?
And also Y chromosome. Chromosome Y is also getting smaller.
But why 100 years ago those men were not in prison who had high testosterone?
Yeah, the rules changed. For hundreds, thousands of years there were wars. So and
They were emptying their testosterone on a battlefield.
so testosterone definitely causes aggression, and it's a topic for psychology actually. Some psychologists, the studies can also say that after contraception, testosterone levels are decreasing. Maybe responsibility was giving men to be like more masculine, and they were having increased testosterone levels, not increased, normal.
Do you think that, going back to masculinity, what you just mentioned, do you think that that can impact the levels of testosterone, just the way man lives? Like if you take average man now who has levels of testosterone that you mentioned, which are much lower than 100 years ago.
Yes.
And if you put that person to live life or put him in the lifestyle of a person from 100 years ago, of a man from 100 years ago, what would happen with his testosterone levels?
Yeah, definitely. It's sedentary. If they live sedentary, definitely testosterone will decrease. So, of course, a man should do exercise often. Stress levels definitely affect testosterone levels. There are many factors that can affect testosterone levels. And there are studies about this too. But it's like a multidisciplinary one. Neurologists, psychologists, psychiatrists should talk about this.
And what about estrogen?
So when a woman comes to 30 years old, she has only 10% of her ovarian reserves. And when she is 40 years old, she has only 3% of all ovaries. Definitely there is an estrogen deficiency, especially after 30 years old.
So estrogen starts declining after
before
30.
menopause. So before menopause, we have lower estrogen levels for 7 years, between 7 and 10 years. It means that you can have menopausal symptoms like starting from your 30 or 35 years old age, which is very early. If these symptoms are too much unbearable, then they can definitely take some HRT. And also, it's not just about mood swings or sweating or the energy level or gaining weight. It also causes, menopause causes high cholesterol levels, increased cardiovascular diseases. So to prevent, by the way, before menopause was a natural process because people were living until their 40s. Not many people were living until their 80s.
Of course.
So menopause was maybe normal like 200 years ago. But today, the lifetime always getting increased. And that's why we need a longer, healthy lifestyle. That's why people can consider HRT. Like around 20 years ago, there were some suspicions about increased cancer risks. But now we know that if we can combine estrogen and progesterone, then we can reduce these risk. That's why it's safe now. No medicine can be 100% safe. There are always pros and cons.
Of course, there's always
Yeah,
side
according
effects.
to the advantage-disadvantage calculation, your doctor will suggest you the best treatment.
So, above the age of 30, females above the age of 30, you're saying that estrogen starts declining. What happens with progesterone, prolactin? What happens with other hormones in response to that?
Prolactin should always remain the same. And estrogen and progesterone, we don't have a stable level. That's why we always check these hormones during the menstruation and between second and fifth days.
So, how frequent would you recommend females
It's not a routine
to check their
female hormones. It's not a checkup for female hormones. If we are talking about LH, FSH, estrogen, and progesterone,
Yes.
it's not a routine.
It's not a routine, but would you recommend, like,
if there are symptoms?
we personally, like, if we have someone who's, let's say, 40, come to us and says, listen, I have these symptoms that might come from hormonal imbalance, okay? And they say, I've tried 1, 2, 3, 4, and it didn't work. I'm gaining weight. I'm eating this,
yes,
I'm getting that
then
way.
we can check.
The first step, what we do is, okay, let's check those hormones.
True.
If they're good, perfect. If there is some issue, we have to address it.
Definitely. For example, sometimes personal trainers are sending us the real patients because they see their clients, they do their best for exercise and diet, but still there is no enough increased muscle mass and not enough fat loss. That's why they are sending us their clients, and yes, then we can catch the patients.
So if you find that someone has low estrogen, the HRT itself, hormonal replacement therapy and estrogen therapy, what would that look like? Would they get some injections or cream, or what kind of treatment would they expect?
There are many types, but I think the easiest ones are patch, transdermal patch,
Okay.
and also vaginal gel. It's like a gel.
Okay.
They can apply and then they can have the HRT. So pills are not a must.
Okay.
And injections
Are not must.
no.
Okay. And do you think that hormonal changes can be delayed with the lifestyle?
Yes. So hormonal changes.
Like, let's
which
say,
hormone?
let's say menopause.
Menopause.
Can menopause be delayed with the right lifestyle? I'm talking about physical activity, I'm talking about food and everything else.
Actually, menopause is usually related to your genetics, so it depends.
It's genetically predetermined.
Yes, usually you are getting into menopause according to your mother's or grandmother's menopause age. But there are some endocrine disruptors, and they can cause premature menopause.
Okay.
Which is another topic. Yes, so we need some good food in good plastics, BPA free.
Okay.
Yeah, but
okay.
Even the water that we're drinking is in a plastic bottle.
Yeah, that's. I mean, we can talk about it for,
we
for
cannot
another
escape.
hour. Yeah. There is, we all know, pandemic of cancer nowadays in the world, and it seems like it's somehow rapidly increasing since years now.
True.
What would you say are 3 main causes of cancer?
So there are many risk factors.
Of course, but like, what would you say are the 3?
Cigarettes, probably smoking.
Cigarettes.
Yes.
Okay. What is the second one?
Foods, we can say unhealthy foods. Yes,
Okay.
because they also causes increased oxidant radicals. And sunlight, but they are not the type 3 ones, Also, sunlight can cause skin cancers.
Skin cancer, yeah.
Yes.
Like, what I would say are, from my perspective, 3. I would say that stress is number 1.
Yeah, actually, when you...
like, if we think logically, in the high presence of stress, I'm not talking about now you get angry for 5 minutes and then you go chill. I'm talking about, like, constant stress.
Yes, chronic anxiety.
Correct. The neurochemistry and the entire chemical responses and functions in the body, as well as hormonal, change.
True.
Due to high presence of stress. So the way our body works will be disrupted. The optimal way our body works.
Yeah, I can understand your point. But so we need some clinical evidence and we need some
Of
design
course.
studies.
Of course, of
When
course.
you design a study, you cannot control everything. That's why many factors are like confounding factors.
Yeah, but like from the studies, we have some pieces of information that are missing, so we cannot have 100%
Sure, yes.
confidence in the conclusion that we make that we made from the study. That's why we have always new studies and these things are changing. But like if you observe from your expertise and experience, and from my experience, people that I know or people or cases that I know, out of all people you know who had or have cancer, what would be the percentage of people who had stress as a factor in their life?
Okay, then maybe we should look at the Amazon, how to say it? You know, there are some people living in the forest.
Yeah, like the tribes and stuff.
Tribes,
yeah.
yes.
Yeah.
Then we need to check the wildlife tribes, for example,
Yeah.
in Amazon or Africa. So they still don't have any stress factor and they don't have any psychological, psychiatric diseases or heart attacks, stroke, or cancer.
They don't have.
Yeah, they don't have.
Okay, but
even if they have, like, it must be very minimal. For example, their LDL cholesterol levels is between 50 and 75 milligram per deciliter, which is a lot low. A lot. None of us can have it now. I can see only maybe 1% of my patients.
Okay, so let's then talk about the tribes who live in Amazon versus people who live in the
Cities.
in the cities and
Yeah, when it comes to health, actually, I'm not sure which one is modern or wild. You know, we call them wildlife, but
Yeah.
in here, maybe this is the wildlife, and then we have these symptoms and diseases.
Well, I mean, it's definitely, I believe we're not designed to live this kind of life.
Yeah.
And I think the stress that we have comes partially from being overstimulated.
True.
Like think about just driving on the highway half an hour.
It's tiring.
Just that.
Yes.
How much stimulation you get for all your senses.
Yeah, even under these lights, for example, you know, mostly we are in indoors and we have lights. But even because of these lights, we have increased cortisol levels, increased inflammation markers. And it causes also stress. Just staying at home under lights.
Of course.
Yeah, we
of course.
should choose the lights wisely. So
There is so many things to think about.
definitely,
It's very
that's why it's not just one thing.
like just
yeah.
thinking about those things make you stressed. I wonder what would happen if a person with early stages of cancer is being taken to Amazon jungle to live with those tribes for a few months.
That's an interesting question. I haven't heard anything like this.
In Serbia, we have some, they're not like official health centers, but they're health centers in nature
Okay.
where cancer patients can go and stay there for, let's say, a few months. And they're basically brought back to 100 years ago in terms of food, in terms of daily activities and everything else.
Okay.
So what happens is that what you mentioned, that these tribes have no diseases or very little comparing
Yes.
to us due to one thing only, which is their lifestyle. It's only one thing. So if we can take a person who's sick or a person who has disease in that environment and that lifestyle, and we both have to agree that body has ability to heal itself if put in the right circumstances.
Yes.
And what all medications do in the end of the day is just stimulate something in the body, stimulate
I
certain
agree.
brain centers and whatever. So if we put a person who's sick in that environment, then clearly we are not just trying to heal it from the outside, but from the inside as well. Like if a person has cancer or any other disease, and the person keeps living the same way and keeps doing the same daily things.
And thinking the same way.
And you try, let's say, okay, you do chemo and you do some treatments and everything else. So you are using only external factors, but internal factors are not changed. So if the external factors are the only source of treatment, and I'm not talking about the effect on the immune system, which could be detrimental, but we don't change anything internally, then logically that success rate will not be the greatest. Whereas if we act both internally and externally, if we have the environment for that person that will stimulate the body to start changing internally, and we have external treatments, then we are doing both at the same time. Like when we work with someone who has a problem with weight, there are two types of stimulation. One is external, with food and with exercise and everything else. But if the body is not optimized, if the body is been storing fat for 15 years and went through 5 pregnancies, and there is a lot of perimenopausal, menopausal changes and whatever, those external stimulations and changes that we do cannot be as effective because the body doesn't want to go in that direction where you're forcing the body to go.
The mindset is really important.
Of course.
They
So we need to change,
mindset.
as you said, mindset, but also we need to change the environment in the body internally to enable body to respond
The
to
treatment.
what we're doing externally.
Yes, for weight loss, actually, it's also quite psychological. For example, we know that obese patients are more fragile and they tend to keep everything in their heart. But fit people are not like this. They can remove a person from their life easier, according to obese patients. And I don't want to say they are cruel, but maybe we can compare and then maybe we can say more cruel. So while they are losing weight, sometimes they have some psychological symptoms and then they can gain the weight again. That's why during weight loss progress, we need some psychological support if needed.
Of course.
And also, fatty tissue is a depot for energy, but also it's a depot for heavy metals or other toxins. So while losing weight, while we are also having these increased toxins in our blood, and it can cause tiredness, fatigue. They cannot, maybe they will wake up very hard. And that's why if a person is losing weight and then feeling that much fatigue or tiredness, they should come and be checked for heavy metals or other toxins in their blood.
Because these toxins are being released from the fat cells and from burning fat.
Yes. True.
We can clearly see, if we want to, how everything in life will be determined and changed by the way we look.
This is not the only treatment, actually. For example, mindset is very important. But for example, radiation exposure. There are some different external factors that will cause the disease, no matter what your mindset is.
Of course, but this is minority. Like if we take 100% of people who are obese or fat, what is the percentage of people who are fat because of their lifestyle choices? If we take all the people who are fat and obese who struggle with these things in the world, what is the percentage of them who struggle with these things because of their lifestyle choices?
Many of them, actually.
Majority.
Yeah,
so
majority.
the radiation and everything else, like there are some people who...
No, I was also talking about the cancer patients, not just obese patients. Now I get you.
Okay. What I'm saying is that all these people, like minority of them, very few have a situation outside their control.
Yeah, sometimes hormonal imbalances is a...
But even, let's say you're a person who have hormonal imbalance and that's the cause for... You can ask for help. You can fix it. Like, I mean,
True.
We have so many tools today that there is no excuse. Like, excuse is not, okay, I have hormonal imbalance, I'm fat, and let me stay like that. That's not excuse anymore. Maybe 100 years ago it was, but now it's not. So whatever the cause is, it's not only, okay, I'm overeating and I'm fat. It can be many things, right? But whatever the cause is, even if it is as complex as hormonal imbalance, it still can be fixed. So in the end of the day, the most important thing, as you already mentioned, is having the right mindset, having the awareness, and having a long-term vision.
Yes.
Because otherwise, if you are in a lazy mindset and if you're just seeing yourself as a slave of pleasures, you will not end up anywhere.
Yeah, I think it's also related to respect to yourself. Everyone is talking about loving yourself, but how about respecting yourself?
But how? Sorry to interrupt. There are many definitions of self-love, and let's finish this podcast with that. I believe that self-love means being aware of your flaws, working on them in order to become a better version of yourself. Because if you love yourself, you should be aiming to become a better version of yourself and to grow. Some people, I believe it's a cope, and they do that because, they want to escape the reality, say that self-love is accepting yourself with your flaws and not changing anything. What is your opinion on that? And here we will finish the podcast.
We always have to be our better versions.
So you agree that
Yes.
self-love means that you are aware of your flaws, but you're overcoming them daily
True.
to become a better version of yourself.
Definitely. And sometimes it comes with pain, not pleasure.
I believe that it always comes with pain, because through pleasure, how can you grow through pleasure?
But in the short term, pain. But in the long term, it's a pleasure.
Correct. To be continued.
Yeah, hopefully.
Have a good day.
You too. Thank you.
Thanks.